Okay, so in continuing with the rest of my nervous system assessment, I'm going to test for the Babinski's reflex. If this was, it is positive in newborns until about 6 months old. If it's positive in a patient, that can indicate some issues with their nervous system. They might have had a stroke that impacted this, the central nervous system, or some traumatic brain injury. So, the way we test this is we're going to look to see that the toes don't flare outwards when I test. And they don't. They actually come in on this patient because he does not have any central nervous system trauma or issues. We can talk about the difference between Bell's palsy and central nervous lesion. With Bell's palsy, it affects the muscles on one side of the face, as does a central nervous lesion. The difference is that in Bell's palsy, the upper and the lower face is affected. Both sides of both upper and lower portions will droop. And in a central nervous lesion, usually it's only the lower part of the face that droops. Your forehead is actually spared usually. With these central nervous lesions, they can be caused from MS, a stroke, or a tumor. Bell's palsy can last 3 to 6 months for it to fully go away and see symptom improvement happens in about 2 weeks, and then full recovery time from that is about 3 to 6 months. Bell's palsy also affects the 7th cranial nerve, and then central nervous lesions can affect some of the other cranial nerves and the 7th. So, in talking about that, we can also check, we can talk about coma rather. So you have a structural coma and a metabolic coma. So structural coma results from bleeding in or around the brain. So hemorrhagic stroke, subarachnoid hemorrhage, subdural and epidural hematomas, ruptured aneurysms, cerebral infarctions or strokes, and brain tumors can cause structural coma. In the metabolic coma, it's caused by oxygen deprivation to the brain, so it can be a result of heart failure, respiratory failure, and asphyxia, massive blood loss, poisoning, overdose of alcohol or drugs. There are several causes for each one. So the main difference is in how they are caused. And like I said, the structural is from bleeding in or around the brain, and the metabolic is caused by oxygen deprivation. And the last thing I'm going to do with my nervous system assessment is I'm going to test for Kernig's and Brudzinski's sign. I'm going to demonstrate how you would test for those. So I'm going to have the patient lay down for me. Make sure we're in a good viewing spot. Okay, and we are. And these two signs are present in patients with meningitis. So with Kernig's sign, we're going to have a patient lay flat, which he is doing. I'm going to flex his thigh at a 90-degree angle, and I'm going to extend it back out. And if this can't be done without pain, then this indicates a positive Kernig's sign. So if he has pain, positive. Did that hurt? Any pain? Okay. Any pain with that? No. Okay, and then we're going to check for Brudzinski's sign. So we're going to have the patient lift his neck off the couch for me. Okay? And we noticed that his legs stayed stationary when he did that. So you can relax. So when a patient who is positive for Brudzinski's sign lifts their head, their legs will involuntarily lift as well. This would be a positive Brudzinski sign. But as we can see, this patient is negative for that. He doesn't have meningitis because his legs stayed flat against the ground or against the couch and did not move with that. So that concludes my assessment of the nervous system.